Thank you, Susan, and good morning. And here's my name. So now I know who I am this morning. It was absolutely a real pleasure to serve as a co-chair for the planning of this workshop with Dr. Warren Newton. I just want to echo Susan's thanks to Patricia and the staff, Megan and Bridget, really incredible staff that really helped us bring our work together. So my job this morning, just very briefly, is to tell you why now? What's the sense of urgency? Why are we here? This is a great time to be having this conversation. As you know, we're in the midst of incredibly rapid health system change, which is really putting new demands on the workforce, right? New roles are emerging for many health professions, right? Population health is a big issue for all of us. We have the Macy report that just came out on our enhanced roles for registered nurses in primary care. We have occupational therapists and physical therapists who are increasingly working in people's homes, helping to really make sure that they don't readmit to the hospital. We have social workers taking on incredible roles in healthcare that they perhaps have always done, but maybe are becoming more to the forefront now as they work in the social determinants of health. We have, as Susan mentioned, a real focus on those social determinants of health. What are those things that happen upstream? And what new roles do those create for the health workforce, right? So increasingly, our definition of the health workforce is changing. Who's in the health workforce? Increasingly, we're looking at boundary spanning roles, those roles that bridge the community and healthcare. So we're looking at community health workers, health coaches, those people who are reaching out into the community. So this transformation has caused role change and new demands for the healthcare workforce. At the same time that new payment models and new care delivery models, accountable care organizations, others, have created a new way of the team interacting. So suddenly we have teams interacting in ways that they haven't interacted before. And the big thing, the big shift for me as a workforce researcher is really focusing on the shift of care from acute to community settings. And what does that mean for the workforce, right? How do we retrain the nurse who has done all of her clinical placements and all of her work in acute care, and suddenly there's great opportunities for nurses in community-based settings? How do we retrain? How do we retool? How do we dynamically respond to those challenges? And these are the challenges that really are helping us sort of frame this workshop, because it's not just about preparing for the students who are in the pipeline. If we're serious about transforming care, folks, we got to retool the 18 million workers who are already in the healthcare system, right? Those are the folks who are going to transform workforce. So and transform healthcare. So we're going to do all of this with constrained resources, right? We're doing this in the context of we're having to find new money, new ways of financing things. And there's this real increased focus on what am I getting for that money? What's the return on investment for those dollars that we put into education? We all know this isn't just a discussion for graduate medical education around the $13 billion we spend. It's also for nursing. It's also for PT and OT. And all of you who are out there running programs, people are saying, what's the return? How are you creating a workforce that is responsive to the needs of the healthcare system and the population? So these create the challenges that are facing us and the absolute timeliness of having this conference today. So really, what are the challenges? We're going to have to keep pace with that rapid transformative change. We're going to have to shift training from acute to community. We're going to have to really focus on interprofessional practice models. And we're going to do this with no money or little money. So the goal of this workshop is to help us think about how we're going to take on that challenge. So we're going to today and tomorrow, we hope this is your learning outcomes for the conference. We hope to increase your understanding of the evidence that is out there. And we're going to lay bare the assumptions that we all have and talk about those assumptions, because sometimes those assumptions create tensions. And so we're going to try to bring those tensions to the forefront so we can talk about them, address them, understand them. We're going to identify the challenges. And then after we do all that, we're going to think creatively about those levers, those financing levers and other levers that we can use to address those challenges. So that's sort of why we're here, that we tried to design the agenda to help move through a set of sort of how the flow would work. So we're going to kick off with Edson, who's really going to frame a big picture, sort of global perspectives on financing health profession education. He's going to talk about the needs of the population on one side, and what the health professions education system is producing on the other, and in between the market that hopefully sends the right signals, but occasionally, and with all due respect to the economists in the audience, the market occasionally fails. So we end up with mismatches, and we're going to talk about those mismatches and the challenges that they create for the health professions financing system. So we're going to do that first, sort of the big global view. And then at 9:50, we're going to do some tabletop work. And we're going to talk about if you were going to design the ideal health professions education financing system, what would those guiding principles be? What would be in the ideal world? It would be responsive to society, and this is all in your one-pager. It would be dynamic. It would be focused on lifelong learning. So we want to sort of engage you. What are the principles of an ideal system? We've come together to this committee with a list, but we're looking to you to help us build out that list. Then we're going to move into the actors. This is where things get interesting, right? Who are the actors who are involved in health professions education financing? This is sort of a classic stakeholder analysis. Who's in this? What kind of influence do they have? What kind of levers can they pull? What do they want to do? How can we incent them? We're going to talk about the actors. Then the good part starts, right? We get into the debates, which really is where we sort of bring the guiding principles and the actors together and see the tensions that they create. And we bring that to the forefront with those debates this morning. And then after we debate, we'll have our appetites up, we'll have lunch. And then in the afternoon, we're sort of going to drill down to take all of that morning work that we did in terms of identifying the principles, identifying the actors, understanding the tensions. And we're going to drill down to real examples. So we're going to start with some exemplars and talk about exemplars from South Africa, the UK, and the US, and sort of hope that those sort of bring that conceptual morning work to reality in terms of some real world examples. And then after that, we're going to break out into groups. You have 4 workshop groups, and that's really where you have chosen the topic of your interest and you really drill down to an area and get into the nitty-gritty of it and see how it's going to work for that specific area. So that's really the sense of what we're doing today, why we're here, how we're going to get there, and where we're going to be at the end of the day. And so at this point, I would like to turn it over to Edson, who will begin our conversation at the 60,000 feet view. So Edson, welcome.